Good evening, I'm Ryan Bonazzo. Thank you for joining us. The Thunder Bay District Health Unit is reporting its highest single-day case count in nearly 8 months. The 22 new infections are the most in one day since April 1st. 21 of them come from the Thunder Bay area, while one is in a First Nation community. 18 of the new cases are a result of close contact. 4 exposure sources are still unknown at this time. There are now 68 active cases across the district. That's the largest active caseload since June 5th, more than 5.5 months ago. Over in the Northwestern Health Unit, there are 3 new cases today in the Dryden-Red Lake area. The NWHU now has 17 active cases. In response to rising case counts across the region, Fort William First Nation announced today that it's closing its municipal offices until further notice. Band leadership says there are currently 7 COVID cases in the community. The first day of vaccinations for children aged 5 to 11 couldn't come soon enough for Thunder Bay elementary schools. The Catholic Board is now dealing with a second outbreak with 5 cases at St. Anne's School, and the Lakehead Board has cases at 2 of its schools as well. Today, many parents brought their little ones to the CLE Coliseum as the lower dose of the Pfizer vaccine was made available for the very first time. Jonathan Wilson reports.
Several thousand children in the Thunder Bay District are now eligible for the vaccine, and the Health Unit's clinic at the CLE Coliseum had at least 100 bookings on the first day. Health Canada announced the approval of the dose, which is 1/3 of the amount given to those aged 12 and up. We spoke to parents who pre-booked their appointments here for their thoughts on getting their child vaccinated.
I think it's great. If it helps us to move past COVID and prevent the spread, absolutely supportive.
We're really excited that the kids could get vaccinated now. It could help protect their younger siblings who can't get vaccinated yet.
They've lived through everything that we have in the last number of months with the pandemic, and I think they've been waiting for this opportunity, and they were happy to do it.
I think it's a good thing personally. I'm hoping it helps bring our numbers down or keep them stable. So I'm pretty excited about it.
And with ages 5 to 11 finally able to get their shots, we also spoke to some of the brave kids after getting their dose about how the experience was for them.
It was good. It didn't hurt as much as I thought it was going to. Well, the good thing about it, I got to color.
Good, didn't hurt at all.
Wasn't too scary?
Nope.
It didn't hurt that much. I was nervous, but it didn't hurt.
I have a fear of needles, but it went pretty well. I thought it would hurt more, but it hurts less than the flu shot.
I'm scared of them too, except once it went into my arm, it wasn't bad.
With at least 5 schools in the Thunder Bay District with positive COVID-19 cases, along with the recent outbreak at St. Martin causing the school to be closed to in-person learning for over a week, we asked parents if they think the younger children now getting vaccinated will help keep the schools open.
Hopefully it'll prevent outbreaks and prevent schools from shutting down again. He had a really hard time with online learning.
I think it will help keep the numbers from going up. If you have vaccination, it doesn't keep you completely safe, but it certainly helps you from spreading it or the spread of it.
Child bookings can be made through the provincial COVID-19 vaccination portal, directly through district health units, or with participating pharmacists and select primary care providers. Jonathan Wilson, TBT News.
Good to see so many kids rolling up their sleeve. Well, the Thunder Bay Catholic District School Board says a rumor circulating online that a young student died outside St. Bernard's School after getting the COVID vaccine is categorically false. The misinformation originated on a notorious local blog. The board responding on Facebook today saying, "We want to reassure our board community that this information is false." The post stated that there was a child-related death related to the COVID-19 vaccine. "We're thankful this awful rumor is untrue." The post continues, "There was an incident which took place on the bus, and we are thankful the student in question is doing well." Canada-US border crossings are going to be a lot busier next week when big changes from Ottawa take effect. Starting at midnight on Tuesday, Canadians will no longer have to produce a costly PCR test upon their return home if they spent less than 3 days out of the country. Corey Nordstrom spoke with Pigeon River border officials today to find out what Canadians should know before they venture south.
we're definitely anticipating that it's going to be busier than it has been here for sure.
Traffic crossing into Canada recently at Pigeon River has mostly been for commercial purposes, but as of Tuesday, that will all change. Canadians can now make short trips to America without needing a PCR test to re-enter the country. Local officials with Canada Border Services say it will likely take at least twice as long to be cleared at the window after the changes.
Be prepared for that process to take longer because there is a lot more involved due to all of the health screening that we're doing.
Fisher wants travelers to be well prepared before they pull up to cross the border. Downloading and uploading information to the Arrive Can app is still a necessity. Having separate proof of vaccine on your phone or physically is also required, in addition to the standard personal information.
It's a requirement. So if you show up and you haven't submitted your information into ArriveCan, you can be put into quarantine for 14 days. If you're put into quarantine at the border, you're legally obligated to carry that quarantine out.
Another thing to remember before traveling south is the high rates of COVID-19 in Minnesota. The land of 10,000 lakes is third in average weekly case counts among North American states and provinces. Thunder Bay District Medical Officer of Health, Dr. Janet DeMille, offers some advice for those who plan on visiting Minnesota.
Ideally, don't hang out with any people who are sick, who have symptoms, because you could be exposed and could get infected as a result of that. Wear a mask, maintain 2 meters distance, be outside as much as you can. I know it gets a little cold, but certainly be in well-ventilated spaces if you're going inside.
And be warned. Travelers who stay even a minute longer than the 72-hour period will have to spend the money on a PCR test proving they didn't contract the virus or quarantine for 2 weeks after returning home. Corey Nordstrom, TBC News.
Well, we told you about the high case count here. The province is also seeing a spike with 927 new infections today and 6 deaths. It's the highest single-day case count in nearly 3 months. And there's fear that a new, possibly more transmissible variant could make the situation even worse. Colin DeMello has more on that.
The Omicron variant is raising alarms in Ontario as infectious disease experts worry about its potential.
These are mutations that would make the virus either A, more transmissible, or B, evade immunity, for example, from infection or vaccination.
A vaccine-resistant variant is among the province's top concerns because of its ability to disrupt the province's reopening plan. And after dealing with the destructive Delta variant, the province's health advisors aren't taking any chances.
The task at hand now is to delay entrance of this variant into the country and into the province of Ontario as long as possible, so that we make it, hopefully, fingers crossed, to next spring, when things, of course, will be less challenging because we all move outside again.
Local level. Today, the Premier met with the Chief Medical Officer of Health to prepare for the worst and to call on the federal government to ban all flights and passengers from countries of concern, to test and quarantine all passengers who've already arrived from those regions, and to reintroduce point-of-arrival testing for all passengers coming to Canada, regardless of where they're coming from. But some believe it might already be too late.
I think we have to realize that at this point in the pandemic, 1.5, almost 2 years in, we know a lot more about the virus than we did back at the beginning. And really, we know these travel bans or travel restrictions don't really work. In fact, I'm pretty sure that the variant is probably already here. It just has not been detected yet.
The Science Advisory Table says the province simply doesn't know, but says it has to seek out the variant.
Let's hope it hasn't gained a foothold yet. That would be great news. But we need to do, of course, whatever we can with genetic sequencing to figure out whether it already is in Canada or not.
The science advisors believe the province needs to ramp up third doses and is calling on the public to limit contacts as much as possible over the Christmas holidays.
We'll have more on the new variant and those travel measures that Canada is putting in place later in the news hour. Thunder Bay Atikokan MPP Judith Monteith-Farrell is once again calling on the Ford government to fix what she calls a broken Northern Health travel grant system. Monteith-Farrell was joined virtually by local residents today who've been left without funds after necessary healthcare trips. She says that's the case for many Northerners and changes are needed as soon as possible. The NDP member first introduced a bill to fix the travel grant in December of 2019, but it's laid dormant ever since. Last week, Monteith-Farrell reintroduced the bill aimed at reviewing and improving the program.
Highlighting the need for this is something that we're heading into an election. Hopefully this will get some attention that in Northern Ontario, we deserve equitable access to healthcare. And that's very fundamental. It's something I hear at the doors, I hear from the public. And so I'm hopeful that that will go forward.
There's a lot of people who aren't as lucky as we are, who can, kind of get lucky enough to recoup from something like that, or even have the opportunity to pay for it up front and actually go forward with the treatment that your pediatrician recommends for you. So we're just incredibly frustrated with how this grant's been working.
Monteith-Farrell has spoken to Minister Greg Rickford about the bill, and she says he seems to be in support. Violence against paramedics is on the rise, and a province-wide study is now underway to quantify those numbers. Officials with Superior North EMS are eager to include the local statistics. They want to change how physical attacks are reported and addressed. Mitchell Ringos has the details.
Since November of 2019, Superior North EMS has had 90 occurrences of violence reported on calls, with 8 being harassment, 23 being physical violence, and 59 being either spitting, biting, or kicking, which led to 46 paramedics requiring first aid, 6 requiring further care, and 3 losing time from work. Superior North EMS Chief Wayne Gates jumped on the opportunity to participate in the province-wide study, as he hopes it can bring more support to the paramedics who are experiencing mental and physical violence on the job, along with an environment they feel safe reporting incidents.
With paramedics, there's a bit of a culture, much like our mental health illness, where a lot of times they won't report it or won't say anything. They'll just accept it as part of the job. So a big goal for me as part of this study is actually to bring that to light and really, get the paramedics involved and really report what's going on out there so it can help us make change.
Unit Chair of Unifor representing local paramedics, Rob Moquin, says for years harassment, violence, and even assault has been seen as part of the job.
It's important for us to start reporting more of the aggression and the assaults that are happening to paramedics in the community. It's unfortunate, but it's a daily occurrence where at least one crew has been assaulted or verbally assaulted, physically assaulted while on the job.
Moquin also pointed out the lack of training for EMS staff for the type of calls they are going to, as the severity of calls they have been getting exceeds their training.
EMS has become the colander of society. I think we're the phone number where we respond to calls that don't necessarily fit other first response protocol. We're dealing with a lot of mental health issues, a lot of social economical issues, and unfortunately the mental health issues we're dealing on the street as paramedics, we're truly not trained in.
Over a dozen paramedic services are already signed up to participate in the provincial-wide study, which plans to report their findings in late 2022 or early 2023. Mitchell Ringos, TBT News.
In 2020, there was a record-breaking number of impaired driving incidents in the Thunder Bay area, and it may not have been an anomaly, as this year's numbers are very high once again. Today, Thunder Bay Police, OPP, and Anishinaabe Police teamed up to launch the 2021 festive ride season. They set up a spot check on Balmoral Street, looking for drivers impaired by alcohol or drugs and conducting mandatory alcohol screenings. So far this year, City Police have already laid 220 charges. 102 of those drivers were impaired by drugs, while 8 refused to provide breath samples. The OPP is also seeing alarming numbers. The various police forces expect there will be even more impaired drivers on the road during the holidays, making the RIDE program more important than ever.
We've had 29 people die as a result of impaired driving in OPP patrolled areas. That's unacceptable. We've investigated 1,900 collisions for impaired driving within the province of Ontario. That's also unacceptable. And we have to do something to combat this. I mean, as we mentioned before with the opioids, I mean, it's a big situation that we have to deal with.
There's a high percentage of our alcohol impaired drivers happen at all times of the day. 24 hours a day, arrested drivers are impaired. So it's not improbable that we would have an impaired driver potentially pass through this ride program. There's likely impaired drivers on the roadway in Thunder Bay right now.
All of the police services encourage drivers to plan ahead with a ride this holiday season and to try to prevent others from getting behind the wheel while impaired whenever possible. Local Christmas cheer and Toys for Tots campaigns were launched today. The annual holiday traditions help thousands of families in need, providing a hamper of groceries and gifts for the kids. And although the charities had to pivot this year due to the pandemic, that won't stop them from making Christmas a little brighter in this community. Catalina Gillies has the story.
The holiday spirit was in full swing with the kickoff of this year's annual Christmas Cheer Fund campaign and the Toys for Tots campaign organized by the Thunder Bay Professional Firefighters Association. The charity partners run their own fundraisers, but then work together to fill the hampers for families who might otherwise go without it at Christmas time.
What we do is we give them that opportunity to breathe and to put smiles on their children's faces. That's the most important thing we can do.
Longtime Chair Jolene Kemp says due to the pandemic, more and more people are accessing food banks. She believes no family should have to choose between paying rent or buying healthy food. The Cheer campaign raised $160,000 last year, and although there's no target for this year, Kemp just wants to meet the need.
A lot of people are not back to work full time, and for many people, they're making minimum wage and no benefits. So people are having to make choices.
Toys for Tots Chair Paul Penna says they also don't have a fundraising goal, but last year the firefighters raised $144,000 and purchased nearly 4,000 toys for the Cheer hampers. He says it's a tradition they look forward to every year.
The need just seems to get bigger every year. You know, there's just more children living in sort of less fortunate circumstances, and for us to be able to make a difference in so many of those children's lives every year after year, and you know, we do it with the help of Thunder Bay, obviously.
With the Health Unit's vaccination clinic occupying the campaign's usual spot at the CLE's Coliseum building, this year the Cheer volunteers will hand out their hampers at the Heritage Building instead. And although the space is smaller, Kemp says it won't have a negative impact.
We've got a well-oiled machine that will make things happen, and we want to do it right because we want everybody to be able to celebrate.
The hamper pickup will take place right here at the Heritage Building on December 14th and 15th. And it's not too late to donate. The Christmas Cheer Fund is still accepting contributions on their website, by mail, and by text. And for in-person donations, the Firefighters Association will be set up at the Intercity Shopping Mall so that every child in the community gets a Christmas they deserve. Catalina Gillies, TBT News.
Well, the winner of November's big Thunder Bay 50-50 draw has been announced. Lucky ticket holder Sandra Kadolf says she tells herself every Thursday before the draw each month not to think about getting that phone call, so she wasn't quite ready when it came earlier today.
Hi Sandra, this is Glenn Craig from the Hospital Foundation. How are you today?
Oh, good. Oh my God.
I just called to tell you you've just won $580,412.
Are you serious? I'm gonna cry right now. I can't believe this. You're serious?
What a nice early Christmas present.
Oh, you have no idea. Oh my God, I can't believe this.
Kadolf is the 10th winner of the Thunder Bay 50-50 draw, which has now doled out more than $6 million to the big winners and provided that same amount of money to fund new medical equipment at the regional hospital. And tickets are already available for the next 50-50 draw, which takes place on December 31st. Well, congratulations, Fiona. Every month I think to myself, maybe I'll be in conflict when I go on the air because it'll be me that will have won. Hasn't happened yet, and on top of it, it's bitterly cold.
Yeah, I don't see that happening anytime soon to either one of us. But yes, it was bitterly cold, especially first thing this morning. Low of -16 and a wind chill of -22 at first light. But we did warm up to -5, not quite seasonal for this time of year, but wind chills kind of tapered off throughout the day, hit -8. That's because the winds were quite light. Started out from the southwest, about 4 kilometers per hour. Picked up to 10 but rotated around from the southeast, so a little bit off the lake. Could be a little bit cooler for some parts of the region this afternoon. But there is warmer air coming in from the west. Fort Frances at this hour, -4, although the wind chill makes it feel close to -7. Kenora at -5, -6 in Dryden, as is Red Lake and Sioux Lookout. Wind chills closer to the -11 range. As you head further east, this is where the temperatures are actually a little bit cooler still. Armstrong at -11, -16 in Greenstone, and there the wind chill is hovering around -18 at this hour with just a few clouds. -11 in Marathon and Sault Ste. Marie, -7, but they have the worst wind chill compared to their actual temperature. Right now it feels like -14 right now. So here in the city of Thunder Bay, we topped out with a high of -5. And here's the good news. It's not going to get any colder tonight. Low of -5 and wind chills around -9. A lot of clouds going to hold in the heat that we've had. And that's going to set the stage for a much more seasonal and milder weekend. I'll have more details later on in the news hour.
Okay, thanks a lot, Fiona. Well, of course, the big top story today, we alluded to it earlier, that new variant that's causing concern not just here in Canada, but across the globe. We'll have details as your Friday News Hour continues.
We are banning the entry of foreign nationals into Canada that have traveled through Southern Africa in the last 14 days.